A tsunami of Medicare Advantage choices. How do you decide? Hello, I'm Kevin Knaus with InsureMeKevin.com, a health insurance agent who helps Medicare beneficiaries find and enroll in a plan that best fits them, their budget, and their health care needs. I have struggled as an agent to help people in this Medicare landscape because it is so complicated. For instance, there is one county in California that has over 60 different Medicare Advantage plans. So going through all the different platforms and looking at which doctors are in network and out, it takes a lot of time, and I don't have a real high confidence rating. But I recently stumbled across an application for agents called FairStreet that helps me get the right information and compares it to the different plans so we can make a choice, a selection, at least narrow it down. Obviously, one of the first things that the application does is it's an intake of just the basic information, where someone lives, the date of birth. But where someone lives, that zip code is very important, because these Medicare Advantage plans, they are by county. So you may be in Los Angeles County and say, oh, that sounds like a great plan, but it may only be offered in Orange County. So with the correct zip code in there, it's going to eliminate, plans that aren't even being offered to you. Then within the application of FairStreet, we enter the drugs that someone is taking, the frequency, the doctors they're seeing, and the pharmacy that they like to go to, because pharmacies are very important when it comes to the Medicare Advantage and prescription drug plans. When we get all that information, then we can go and kind of start searching for plans, and we can filter the plan selections that are displayed by a couple of, whether the doctor's in network, if there's a particular monthly budget someone is working with, if someone wants some additional benefits related to hearing or vision or a fitness plan, we can check mark those as well and filter out just for those plans that have some of those core benefits. Then we are given comparison. We can do a comparison. I've just done a 3 side by side here to kind of give you a flavor what it is. And the FairStreet, it tells us what the annual costs are going to be. And that includes, if it's a Medicare Advantage plan, the drug costs as well. And it shows the plan star ratings on there. So it's giving us a better visual review of the plans that meet the criteria for the Medicare beneficiary. But of course, the costs aren't the entire story. The health care benefits and the cost sharing are also very important and can really be instrumental in making a decision. So like on these particular 3 plans, you can see that maximum out of pocket, it varies. One plan, the first plan is $4,500. Plan 2 is $800, Plan 3 is $2,900. So for some people, that maximum annual out-of-pocket amount is very important, and they might want to go with the lowest one. So maybe they'll be biased, but at least we can kind of see that on a side-by-side comparison, sit back, take our time, and then come back and review it. With some of the other platforms I've used, you kind of lose all that information and you have to recreate the wheel. Now, not everyone wants a Medicare Advantage plan. Some people want original Medicare with a supplement and a Part D prescription drug plan, and the FairStreet platform that I'm using will also analyze those based on the drugs and the pharmacies that we put in there. So on the Part D plan comparison, you can see, we've put in the drugs, and it will tell us the annual costs of the plan, and that is generally the monthly premiums plus the cost of the drugs. And you can see the plan premiums are displayed and the plan star ratings. But what I really like, and it's very easy, is the monthly drug cost calculator. So we can kind of go down and look month by month when someone goes to their deductible, when they go into the co-payments, because budgeting can be very, very important. So we kind of want to see how much are the drugs going to cost per month, because that's a hard fixed cost. Unlike, I don't know when I'm going to go see the doctor and what he's going to order. I know I'm going to be taking these medications, so you have a good firm handle on those drug costs. And next, when we were putting in the information about the drugs and the pharmacy, it will tell us the network status, because some pharmacies with these drug plans and also the Medicare Advantage plans are preferred, some of them are standard, some of them are out in network, and you want to make sure that the plan you select aligns with a pharmacy that you want to visit, because if it's a standard or an out-of-network pharmacy, you're going to pay more for the drugs. And so that's real key. And this particular platform, the FairStreet, helps me really zero in on that so we don't make a mistake. So someone's going to CVS, but they have a plan that is preferred with Walgreens or something of that nature. The FairStreet platform also helps me stay compliant. There are a lot of Medicare marketing rules. As you saw in those examples, I did not put any of the carriers' names in there because those were actual plans, because I can't. As an agent, I can't display a particular carrier with a plan premium and benefits to you. That's a no-no. There are other rules that I must also follow. Now, in a one-on-one, sure, we can go all over all of that. But in a situation like this, where I'm putting it out there in a YouTube video, I can't list those carriers and the different plan benefits. And of course, we need a scope of appointment before we talk about any of that. And one of the new Medicare marketing rules is that all these enrollments, if they're done over a phone, must be recorded. So that's built into the system too. So the FairStreet's helping me stay compliant, and then I can go back and I can see, okay, we have this, we talked about that, and we can really make sure that we have dotted all the I's and crossed all the T's. Now, I was skeptical and suspicious of this FairStreet. And when Sarah called me, she probably hung up the phone thinking, what a cranky old man, because I just didn't think anyone was going to make Medicare any easier for me. But then I kept talking to her and some of the other people involved in FairStreet, and I heard a different perspective to approaching Medicare and helping people. It was not sales oriented. It was information, education oriented, and review and analysis. And that was refreshing, because that's the way I approach Medicare. Well, all of my health insurance enrollments. First, you have to be educated. Remember my tagline, education before enrollment. So that's kind of, they're on the same level. And they kind of bring a different perspective to this whole Medicare thing, understanding that it is complicated. So we need to try and zero in on those particulars that are mission critical for the individual. It might be the monthly rate. It may be having certain drugs covered, or seeing certain doctors, or certain other benefits. And we can boil that down so that a consumer, a Medicare beneficiary, is only looking at those plans that meet their criteria. And that allows me to sleep at night that I've helped someone enroll in a plan that best fits their needs, and the margin of error for a big surprise is very small. So if you have any questions about this FairStreet and how I go about helping people enroll into a Medicare Advantage plan, you may leave a comment down below. You can reach out to me through email or give me a call with my phone, and we will answer your questions. So for Insure Me Kevin, I am Kevin Knaus.